The most important thing about this breast cancer is that this lump is usually painless in most of the patient, and that's why it doesn't bother the patient, it doesn't give any kind of problem to the patient, and that's why it is usually ignored. Hello, I am Dr. Suhas Agre, consultant medical oncologist, Mumbai. Currently, this October month is being viewed as a breast cancer awareness month. So, we would be discussing some of the important points related to the breast cancer. Now in India, the number of the breast cancer cases has increased tremendously. So, most of the cases we normally see in our OPD also, there has also a number of the increase in the cases. So why there are certain factors, there are certain things what we need to remember about the breast cancer. So normally this breast cancer would present as an abnormal swelling, or we call it as a lump in the breast or the underarms. The most important thing about this breast cancer is that this lump is usually painless in most of the patient, and that's why it doesn't bother the patient, it doesn't give any kind of problem to the patient, and that's why it is usually ignored. So what is important is that you have to remember that any lump which is felt in the breast or the underarms has to be evaluated. So apart from that, there can be other signs of the breast cancer, like sometimes there is an orange peel appearance of the skin of the breast, change in the size of the breast, there might be some inversion or indrawing of the nipple, or sometimes there can be some reddish discoloration of the skin of the breast. Apart from that, certain patient can also have some bleeding discharge from the nipple. So when any of the breast lump, it normally is viewed as a two types. One we call it as a benign and other is called as a malignant. Benign means it doesn't have a capacity or ability to spread elsewhere, but those cancerous, or we call it as a malignant, they would spread to the other areas. So apart from that, we advise the patient to undergo certain tests. So which are these tests? So most important test would be doing an mammography or a breast ultrasound. Apart from the mammography, what we advise them is that doing one core needle biopsy. So we advise that patient to undergo a biopsy from that particular lump, and that is again subjected to the pathological testing, and that will confirm the diagnosis of the breast cancer. The common question that comes to the mind is that what are the risk factors for the development of the breast cancer? Normally, as the age increases, risk of the breast cancer increases. Secondly, the females are more common as compared to the males. So, but it is not like that, it happens only in the females. There are many cases which can be seen in the males also. So, because why it is common in the female? It is because of the estrogen hormone, and this breast cancer is an hormone dependent or the hormone driven tumor. So more is the exposure to the estrogen hormone during the lifetime, it increases the risk of the breast cancer development. How this exposure to the hormone occurs? It occurs after the start of the menarche till the end of the menopause. So apart from that, there are other reasons like any factor that would increases the exposure to the estrogen, like delayed age of the first childbirth, or maybe not being pregnant, or what we call it as an nulliparous females. So even in the lack of the breastfeeding, that all these factors increases the exposure of the estrogen hormone, and that increases the risk of the breast cancer. Apart from that, nowadays there are many factors which are contributing to the development of the breast cancer, are like lack of the physical activity, lack of the exercises, being overweight or the obesity is an important risk factor. Apart from that, consumption of the alcohol, smoking, these are also an important risk factors for the breast cancer development. Apart from that, we can see almost a minority or minor breast of the some of the breast cancer cases which can be hereditary in the nature. hereditary means which can be transmitted from one generation to the other generation of the patient. So whenever any clustering of the cancer cases in the family, clustering of the multiple breast cancers in the family, or say ovary cancer, some pancreatic or the prostate cancer, we have to evaluate the hereditary component of the breast cancer in these cases. There are certain methods which has been seen as a screening methods for the breast cancer, like doing a mammography after the age of the 40 years, once in a year or maybe once in 2 years, that is an adequately advised. So apart from that, breast self-examination has to be done by every individual, every female individual, at least once a month, and then we can do the clinical examination as per the requirements or as per the state. So apart from that, suppose any individual, any female who has been affected with one side of the breast cancer, she is having the risk of having the breast cancer on the opposite side also. So she has to undergo regular follow-up checkup for that particular cancer, either detection or the prevention as well. So now coming toward the treatment part. So as lies with the most of the cancer, breast cancer is also not an exception for the saying that early diagnosis means the cure. So what should be the focus is that earliest diagnosis of the breast cancer should be of very important thing. So because as we are aware that as we move from the early stages to the late stage, so the chance of the cure decreases. So our most important motive or intention should be the diagnosis of the breast cancer lump at an early stages, rather than having a big lump which is having a capacity which might spread to the other organ, where obviously the chance of the cure will be lesser. So in that case, we have to identify the lump, the breast lump at an early stages, and that obviously increases the chance of the cure. So if we take the stage 1 breast cancer, almost cure rate goes to the 90%. Stage 2, if the cure rate goes to almost 70 to 80%. Stage 3, it is somewhere around 50 to 60%, while very few patients from the stage 4, that too also limited disease, can be taken care of. If you want to watch more such videos, please subscribe and like this YouTube channel. Thank you.